Awesome. Thank you. Hi, Maya. Welcome.
Hello.
All right. Well, why don't we get started? Because I know we only have an hour with you all today. AJ, as people are coming in, do you mind admitting them for me, or Dr. Cooper, whoever's able to do so?
Yep.
Thank you so much. All right. Good morning, everyone. Welcome to this month's Healthy Start Work Group meeting. We appreciate you all being here. I'm actually going to go ahead and turn it over to Dr. Cooper, who will give us our official welcome for today.
Good morning, everyone, and welcome. Please, if you don't mind, type in your name and your organization in the chat. So we would like to know who's here and how we can better engage. And then please note this meeting will be recorded. Now, as far as today's agenda, as Shanae had said, it is a packed agenda, but we're going to accomplish a lot. We're going to start with the welcome and review of meeting agenda, which we're doing now, the Community Health Improvement Plan, the CHIP overview, and we're going to also review the maternal and infant health problem statement and the root causes. We're going to select, make a selection of action plan and where we're going to start there. We're going to also move into the goal setting and then pivot into community announcements and then adjourn.
So, thank you, Dr. Cooper. All right, so to quickly ground us, I'm just going to provide, again, just a quick overview of our Community Health Improvement Plan, or the CHIP, as we call it, and where we are in the process. I see some new faces, some new names in, so I just want to make sure we're all starting from the same place. So if it's familiar to some, just hang in there with me. I promise it'll be quick. But just as a reminder, this CHIP is our shared roadmap for improving health outcomes and advancing health equity in our county. I always like to say it's community driven, it's data informed, and it really does focus on how we align our partners around shared priorities over a 3-year period. And this work is guided by the MAP 2.0 framework and builds on our 2025 Community Health Assessment, or the CHA. And that CHA identified 5 key priority areas, which are to the right of your slide, with maternal and infant health being one of them. Now, all of this work comes together to help us get to the point of CHIP development. So our community health assessment tells us what is happening in our community by helping us better understand our health outcomes, the conditions that people are living in, as well as the factors that influence their health every day. The root cause analysis discussions that we had in January helped us understand why these issues are happening. And then the CHIP is where we decide how we want to move forward together. So today, we're building on that foundation by identifying a priority starting point. We'll talk a little bit about what success might look like in 3 years, and then begin to start shaping some of those goal and objective statements. So this is a working session. The focus is on direction, not perfection. But with that, I am going to turn it over to AJ for a quick refresher on the problem statement and the root causes. AJ?
Thank you, Shanae. So the problem statement selected by our CHIP steering committee highlights many pregnant people lack consistent prenatal and postpartum care, particularly those with Medicaid or without insurance. Some of the data from our 2025 community health assessment shows that since 2013, Prince George's County has had a higher percentage of late or no prenatal care compared to the state, 11.8% in 2022 versus 7.5% statewide. Maternal mortality rates remain higher than the Maryland average, and there's a low birth weight has exceeded the state rate since 2013. So why does this matter, right? So these gaps disproportionately impact people with Medicaid or no insurance, and they contribute to avoidable complications and long-term impacts for families. In January, our root cause analysis highlighted key drivers of inconsistent prenatal, postpartum, and childcare. We saw challenges with access, provider capacity, system navigation. We also heard about trust and cultural barriers, education gaps, and drops in care continuity, especially after birth with postpartum care, drops off and missed well child visits. And so using the 5 whys, we dug a little bit deeper. Limited access, overburdened providers, and a system that prioritizes acute over preventative care all play a role. Navigation challenges and costs, those things also add further barriers and often discourage families. And at the root, we see structural underinvestment, right? Workforce shortages and inequities. And so the key takeaway that we agreed on was that when we strengthen community care, workforce capacity, and navigation support, we can improve maternal and child health outcomes.
Awesome. Thanks,
And
AJ.
that brings us to our starting points. Yep.
Yeah. So to AJ's point, considering the discussion that we had back in January, as well as the selected problem statement and some of the key data points that AJ reminded us of, we used all of that and tried to identify a few starting points to really help us focus our efforts for the CHIP. Now, I do recognize that there are many ways that we can address this, right? But rather than trying to tackle everything at once, trying to throw all our resources, all of our time into a bunch of different things, we're going to focus on identifying a strong starting point instead, something that feels meaningful, something that's feasible, and something that aligns with our existing efforts. So think quality over quantity, right? And so this is gonna help us focus on where we want to act first. So on the slide, I'm sharing some starting points that again were informed by the data as well as our discussions. And as I share, I do encourage you to think really about like which of these feels most important for this group to focus on over the next 3 years, right? So what starting point feels most pressing to you? What feels most realistic given timing, giving funding, giving the resources that exist in the community. And maybe there's an area that's here that we already have some momentum, we already have strong partnership, or something we can kind of build a bit further on, okay? So let me run through these quickly for you all. First, we have access to prenatal and postpartum care. And, some of the discussion that we had was that care continues to be a central challenge, especially for families with Medicaid or no insurance. Many families aren't getting care early or consistently. And so strengthening some entry points into care and strengthening continuity of care would be key. We also heard that workforce capacity really matters. In some areas, there simply just aren't enough providers. And not only that, but we also need a more diverse workforce as well to really make sure that care is culturally responsive and aligned with our community's needs. We also see that even when services do exist, families still struggle with system navigation and care coordination. And that's something we've heard across all work groups. This system can feel quite fragmented. It can be overwhelming. It can be confusing. So improving coordination and making it easier to move between services would really go a long way. Another key theme that came out of our discussions in the data is around prevention and early intervention. We see that there's a strong opportunity to try to engage our families much earlier on, whether that's through outreach, education, additional preventive supports, so that care begins sooner. And again, that continuity piece, right? It continues consistently rather than reacting when an issue arises. And then finally, we can't ignore the impact of social and structural supports for families, right? So we know that social determinants of health, transportation, things like childcare, cost of services, insurance gaps, those continue to limit access for many, even when services are available. So addressing these may be critical to making everything else work better. Right, so I wanted to present these to you all and then kind of open the floor for just a few minutes for initial feedback. Are any of these starting points, any of these speak to you? Is there something that you feel strongly about that we should, start with when it comes to our goal development and our strategy development? Or is there something on this list that's like, hey, we have tried everything we can think of to address this. Let's not do it this time, So I'm open to both sides of the spectrum, or both sides of the coin, either end of the spectrum, but I do want to open the floor just for some initial feedback. And you can write in the chat or you can unmute yourselves to speak. Dawn?
Good morning. Thank you for this information. It's great to be a part of this discussion today. It is my first meeting with you all here in PG County as part of the network. So thank you for whoever extended the invite out to La Clinica. I wanted to ask just briefly, because this is such a great important topic, as we look at our systems in place currently to increase prenatal care services and pediatrics by hiring new providers in our network to provide that service and to revamp all of what we're doing right now. And this is certainly on our radar as an important discussion and topic of concern. But I wanted to know if the project had any data. Thank you for sharing the data early in the presentation. But was there data that we compared other counties in Maryland and their rates of success in this network to see what they've done? And try to mimic some of the things that they've done where their highest success rates were, and then transition that into the project. Because that seems like a good landing space to just take what other people have done and where their highest success rates have been. For instance, I don't know if, and it might be here in the presentation, home visiting after delivery seems to be a big success rate if we're able to accomplish that. And I'm not saying that we're able to accomplish that as a county, and resources and funding, of course, take a lot to do that. But I know that other counties in Maryland have had success with that when they've been able to implement into their processes. So just a question or
Sure.
thoughts.
Great question, great thought. So have you had a chance to look at our 2025 community health assessment yet? And if you haven't,
Sorry, I have not. I apologize that I wasn't able to do that. I just got this across my desk this morning to attend this meeting. So
no, that's absolutely
I'm
fine.
here.
I asked that to say I'm happy to send that to you because that is definitely
Great.
where a lot of this came from. They used key informants to help collect data. They used system data to get that information. We also know that there are local health improvement coalitions across the state. So we have access to some of their reports, some of their older community health improvement plans as well, and some of the measures that they use, what worked, what didn't work. So we have access to that information. And so that's actually kind of where a lot of this conversation came in. A lot of the key points, the key starting points that came out of those root cause analysis discussions are very similar, not just, with various organizations in Prince George's, but across jurisdictions, across county lines. We're having the same conversations. And so that is definitely something that we can look a bit further into. While this is our starting point, the next step of this process is looking into and developing actual strategies. And so that's where I'm going to look to you all like, hey, what's working everywhere else? What are other people doing? And how can we implement that here in the county? So those are definitely things that will be a part of this process. I hope that answers your question.
Perfect. Thank you. Yes, it does. And thank you for sharing the other previous documentation.
Of course, I'll be sure to share that out in the follow-up email to our meeting for anyone else who hasn't seen it as well. Any other feedback on some of these starting points? Anything that feels urgent, something that feels feasible, something we should completely disregard? Dr. Epgar, perhaps the most cost-effective starting point is via communication that addresses system navigation and prevention topics. This could be a web-based sign-up for email or text outreach, social media sites that promote health in small bites trimester week. Yeah, I love that. Great. Great idea. Any other feedback?
I just want to throw some follow-up out there too. I mean, to the point that was made earlier is how can we keep people in their homes and help them get care, or in their place of work where that's kind of my point. If you could just say, look, hey, you're in your first trimester, have you been able to get access to X, Y, or Z? Or here's your information for week 24. Here's what you should know. Here's what your provider wants you to know. What questions do you have? I don't know that it could be necessarily interactive. That might be less cost effective and more cost bearing. But I think, and to be frank, I always come from a point where no one wants to be bothered necessarily with having to get in their car or transport themselves, their families into an office, let alone undergo a GYN or an OB exam, right? That isn't just listening to the baby's heartbeat. So I kind of come from that lens first. So how can we make this not onerous to anybody? And so if you could get people that were interested, maybe this has been done before too. If you get a site of interest where people sign up and say, yeah, hey, send me those blasts. So, and here's my due date. So they would get specific trimester or week related information that doesn't ask them to try and complete their entire pregnancy in one website or one email. But rather really takes it and just get a little bite here, a little bite there, and digestible, very quickly digestible information.
I love that. I love that. I think that's a great idea. And so that would kind of go along with our seeing maybe prevention and early intervention.
Yeah, I was hoping it would cover that, maybe some system navigation. Here's how you get this, here you got to get that, and maybe break down some of those barriers, those social determinants like transportation. What am I going to do with my kid? How can I can't come in, or I can't get off work for that matter,
Yeah. Yeah, it covers quite a few gamuts actually. And that's something that we've seen in some of the other work groups as well. Like there's overlap in a lot of the starting points, and which is fine because when we get ready to start drafting those goals, which will come next, we might be able to touch on some of these things. So that's wonderful. I love that feedback. Thank you. I see a comment in the chat. I was thinking that the social and structural support was something that could be a tangible, quick-ish win. System change takes longer and is important, but there are things that could be done now to make access to care easier. I agree. Dawn, how does technology play a role for increasing access? We can have that discussion. And Melanie, does the existing data show good movement on any efforts or activities that could be expanded? And we can dig deeper into that as well. Any feedback on those questions posed or any additional comments?
I'd just like to say, excuse me, I do see a greater role for CHWs, the community health workers, especially when we talk about bringing care to where folks are in the community. So I think that would bring great value to this whole process. The health education, literacy portion, the engagement, connection to the medical community, and bringing about those solutions or those issues so that we can better equip to address those particular problems that are being constantly identified, and identifying what's working and of course what needs to be tweaked.
I agree. Absolutely agree. And to Dawn's point, I think technology can play a great role for increasing access. And on the other end of the spectrum, we have to remember that not everyone has access to technology. So we have to be mindful of being equitable in the solutions and the strategies that we bring to the table. So it's kind of like a both and. We can't just focus on technology because that leaves a portion of people out and vice versa. I also assume that providers include midwives and doulas. Yes. Thank you, Melanie. Okay. Well, with that, we can go on to the next part, which is exciting. One piece of this is quite exciting. While all of these areas, like we said, are kind of interconnected, again, it really just simply isn't feasible for this group to focus on all of these things simultaneously or, try to address every single thing, unless we have something creative, kind of to Dr. Apgar's point where it touches briefly on most of these points. So what we're going to do next is we're actually going to vote to focus on one of these starting points to help us stay aligned, to help us stay measurable as well as impactful. So I'm going to open up the polling option in the chat. And as I do that, and as you all take your vote, I want you all to think about, again, where our collective efforts can make the greatest impact over the next 3 years. Because again, this CHIP cycle is a 3-year cycle. And specifically, excuse me, which option allows us to be the most focused and effective as we move into action planning. So I'm going to go ahead and open up the chat, the polling option. Give me 1 second to make that available to you all. Let's see. All right, this should be it. Is everyone able to see the options pop up? We have 8 responses so far. 10 responses so far. 11 responses, 12. Great. I love this. I'll give another 10, 15 seconds for those who might be reading through and still voting. But yes, which option allows us to be the most focused and effective for our action planning? Great. Okay. So it looks like system navigation and care coordination. Great. So how to improve how families find, access, and move through maternal infant health services. Love that. Great. Okay. Well, moving right along then. I appreciate you all leaning into that process. So what we're going to do is we're actually going to use this starting point to guide the rest of our work today. So we're going to move into goal setting. And as we move into goal setting, we want to think a bit more broadly before just jumping right into solutions, right? I think that's something that happens quite often when people are making plans and strategic plans and action plans. We're like, let's just figure out what we want to do right away. And I think it's really important to take a step back and think more broadly, kind of use some divergent thinking to think of creative approaches to what it is that you're trying to do with your plan, right? So this helps us create goals that are a bit more inclusive as well as a bit more impactful. And again, I think it gives us the opportunity to consider, what does success look like in 3 years? What would actually be different when we hit that 3-year marks? It helps us think about, who's going to benefit from this plan? How are they going to benefit? Who's missing from this? And so we want to make sure that, we take that approach with goal setting. So that brings us to our core question. Again, starting more broadly, but with the problem statement and now this starting point in mind, I'm going to open the floor. What would success look like 3 years from now? And actually, AJ, if you're able to share the whiteboard, and what we'll do is as we're brainstorming, we'll drop your thoughts down onto our whiteboard so we can see that visually for us. Is everyone able to see AJ's whiteboard? I see some thumbs up. Awesome. Thank you. All right. So yes, so with the problem statement and starting point in mind, what would success look like 3 years from now? And again, you're welcome to use the chat. You can unmute yourselves to share, and we'll just start dropping some of your ideas. Chat responses. Dr. Apgar, I think the community we serve deserves to weigh in on this. Absolutely. What does it look like to them? How can we meet them? Great thought. And we can definitely continue to solicit their feedback throughout this process as well. Is someone unmuted? Care to share?
I like the comment that was just stated. I think starting with system navigation and care coordination, I think success looks like being able to very easily find somebody trustable, or even a computer that's trustable, even an avatar that's trustable, that you can access and understand where you have resources without having to leave your home, without having to leave your source of comfort, your place of comfort.
Yeah, that's great. Thank you, Dr. Apgar.
Something that I was going to mention earlier is that at WellPoint, and I know this wouldn't apply to everyone in PG County, but I'm just using it as an example. We have an app called Concierge Care that we provide to all of our pregnant members. It's customized to them, their pregnancy, their situation. They can indicate their due date, any high risk concerns, and then it sends them notifications, reminders. They have different things they can interact with in the app. There's a library of videos and education and things like that, which, goes along, I think, with what was being mentioned earlier. So, if something like that could be made available to the community that also included a feature of, finding resources, locating, reminders for appointments, linking them to transportation services, things like that, I think that would be huge. And also, I think somebody else mentioned social media. I think that's a huge thing also. I cannot tell you how many women that I talk to daily, maybe not our older moms, but even them too, but so many, I have to tell them, I love that you are on TikTok and you're seeing these videos, but please make sure you're getting the education from trusted sources. So if we could get trusted sources out there in front of what they're already viewing daily, that would be huge also, I think.
I love that. Great ideas. Thank you. I haven't heard of concierge care, so I'm going to look into that. Is anyone else using that outside of WellPoint?
I believe it was developed for us.
Oh, okay, great.
I don't know. I know that the company that developed it is called Sidekick. But I don't know if it's something, I could be wrong, but I know that we were heavily involved in the development of it, and a lot of the education and things are the faces and voices of some of the people within our organization. So but Sidekick is the company that developed it for us.
That's helpful. Thank you so much. I'm definitely gonna look into that. That's great. And thank you for sharing. We have a few additional comments. Sorry. Annie says, people, regardless of insurance status, understand when and how to access care and successfully receive the services they need to support healthy outcomes. Jennifer says, agreed. I think learning the barriers most challenging to the community would help direct the focus. Absolutely. Dr. Cooper, increase in provider access and resources. Melanie, reduction in late to no prenatal care and in-person centered ways. What do pregnant people say success means and looks like? Yes, getting that feedback. Dr. Cooper, resources, pre, current, and post-pregnancy that are linguistically appropriate. Absolutely. Keeping that equity piece in mind. Thank you, Dr. Cooper. Melanie, the postpartum period is strengthened, better connection to primary care, behavioral health support would need to create metrics around what strengthened means or looks like. Absolutely. We'll get a chance to do all of that in our strategy development process too. So this is great. Done. Success would look like an increased percentage of patients getting into care timely and successfully continuing care. Awesome.
Shanae, may I also add the nutritional aspect of that? Nutrition.
Absolutely. Do you want to expand a bit more on that?
Yeah, I mean, we want to look at nutrition at all aspects during the pregnancy. And I always like to look at it from the before you become pregnant, what sort of nutrition exists? Am I eating the right foods that are going to lead to the proper outcomes? Do I have access to that food? So that's when we look at that social determinant of health. And I think that plays a very important part of this equation.
Thank you for that feedback. All right, so hearing from our fellow partners and hearing some of the comments, we have another one from Sharon Zalewski, ways to capture people who fall through the cracks. Yes, that's also important. Absolutely. This is great, everyone. Thank you so much for participating, for this feedback. And again, hearing the feedback from the partners and reading some of these comments, what are some of the common themes that you're hearing? One thing I'm hearing is community feedback, right? Community voice. Any other common themes?
My provider doesn't understand me culturally and what my needs are. They're not listening to me.
Patient-provider communication.
Yeah, I agree. It's too much of time. This is Melanie. I think that's just it. Like in Prince George's County, we know we're largely talking about Black and Latinx people. So it's tied to more, maternal deaths. So I have to second that. Like, what does it mean for them to be seen and heard by their provider?
Of that. This is great. Any other common themes?
And I think this all, actually goes back to what we said earlier, geographical location. Back in the day when I was in Medicaid managed care in DC, it was called geo access. How close is that provider to my home? How easy is it to access? So it's, that geo access, transportation, the hours, the convenience. And that's where it would just behoove us to integrate the midwives, the community health workers, the doulas, and taking some traditional as well as non-traditional approaches to be able to address solution-based approaches.
I was just going to say that traditional versus non-traditional approaches. Great. To access care and education. Right? I love that. Okay. Any other common themes? Carrie, transportation is a major issue, especially with the Spanish-speaking population. Many moms stay home with their kids while the husbands work. Some offices don't allow children. Yes, that is a huge barrier that many women come across. So that's absolutely true. And Jennifer, I missed your comment. I apologize. We have learned that many providers are not always using interpreters when serving Spanish-speaking patients. Absolutely. So we want to make sure we're providing culturally appropriate and linguistic care, right? That could be another common theme, culturally appropriate care. Great. Thank you all for this feedback. This is fantastic. Okay, so as you can see, we're kind of starting to connect the dots a little bit here. So we've brainstormed a bit about what success could look like for individuals, for our families, for the community as a whole. We're, coming up with some common themes based on that feedback. And now I want to use those common themes to start to shape them into some goals. Dr. Cooper, case management services. Yes, 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 great. So what we're going to do is, AJ, you're making me dizzy. We're going to use a simple structure or a simple formula to kind of help us slowly draft some goals. And so this goal setting formula, pretty simple. We want to either increase, improve, or reduce what for who, by how much or in what way, by when, right? And so our when can be any point within our 3-year cycle. So we don't need to figure that part of the formula out yet. So let's just focus on the other pieces first, the who, the what, and the how much, right? And for this part, I don't need perfect wording, right? We're just drafting. We can go back and refine later. But for now, let's just focus on clarifying what our goals are and direction. And again, we want to keep equity at the center, which we've been doing with some of the comments that we're hearing, right? Making sure we're addressing certain populations, that we're being culturally appropriate, that we're considering other barriers like that. So a couple of examples are provided on the screen for you. And it's a little small for me to see, but one example, if we were to address system navigation and care coordination, one of these could be, we can improve access to and navigation of maternal health services for pregnant and postpartum people, implementing coordinated care navigation supports that connect families to prenatal, postpartum, and related services by, and again, we don't have a set date yet, right? So that's just one example. If we were to focus on prevention and early intervention, an example goal might be, we want to increase early engagement in prenatal care among pregnant people by raising first trimester prenatal care initiation by X% through outreach, education, preventive supports. So these are just examples. Again, not looking for perfect language, but just getting some ideas, right? What are some ways that we can use these common themes to develop our drafted goal statements? And again, you're welcome to use the chat or to unmute yourselves to speak.
I don't know, this is just a thought. What about, again, I'm going to circle back to case management social services because they've been great conduits in identifying needs and connecting individuals to services within the community. And it could be a wide spectrum of services from transportation, childcare, medical, behavioral health, those sort of things. And I know this is a model that has been used in other particular enterprises, but I think it can also be successful into healthcare as a healthcare model as well.
Great.
And that was something we also used in at the DC Medicaid Managed Care Program 100 years ago.
That's fantastic.
And
I'd
it
be
built in
interested
that
in learning more.
accountability, and it built in that accountability as well. Because the case manager of social services would circle back to make sure, one, that there was some sort of connection, and two, what was the outcome of the connection.
That's interesting. I'd like to learn more about that. If you have any additional information on that, I'd be happy to
I
receive
can
that if you
conjure up
could.
what's in my brain and
Yeah.
what we did, and because we did the EPSDT services, the early childhood periodic diagnosis and treatment, and the prenatal, it was just behavioral health, which is substance and mental health service as well, just a full spectrum of services in order to address bridge those particular gaps in healthcare outcomes and getting people connected to services in a timely fashion.
Fantastic. Thank you for sharing that.
So something that just popped into my head, I don't know if this is what you're looking for or not, but as a case manager, I know that's something that would be helpful for me, but I also think it could be done in a way that could be made available to the community as well, would be some sort of directory. So just as an example, I believe that all of the MCOs have case management available. So a directory, if you have this MCO, how do you get in touch with your maternal health OB case manager? If you're a case manager, like what's the best place to send this patient to for this issue, and just having even a high level directory, because I know for us, a lot of times we're like hunting and searching and trying to figure out who can we send this person to, and we'll send referrals to the local health department and they send them to us. But it would be nice to have some sort of directory of those types of things.
Okay.
And I feel like that could probably be quickly and easily, by quickly, I mean, in a few months, maybe put together and made accessible.
Yeah, I
And
love that. I love that idea. So kind of trying to, it brings me back to some of the feedback from some of the other work groups. They have also requested some kind of like central hub for information. And so, you know, they're using Find Help. I don't know if you all are familiar with Find Help, but they're using that as a way to send referrals to various organizations to get connected to care. If they come across a patient who's having transportation issues, they can log that patient's information into the Find Help system and get transportation information based on their zip code. So that kind of ties into the geo access, Dr. Cooper. And so that's something that some partners are using, more partners are interested in learning more about, and something that they've been including in their goal development strategies. I know we have our behavioral health directory on our PGC Health Zone website. So that's something that we could also consider developing as specific to the OBs. So yeah, I think that's a great idea. So thank you for that feedback. Sharon Zaluski? We have two Sharons in the group, so.
Hi, I just wanted to say that Find Help is a little bit overwhelming.
Okay.
And when you put in, you may find a long list of resources, many with very small nonprofit organizations are included in that, and many who don't answer their phones or only have part-time staff or staff by volunteers. And so I think somebody had mentioned high level. So I think really focusing on a resource guide that gives you to a more centralized, higher level place to begin with, where you know that somebody's going to call and the phone's going to be answered, you know, or somebody's going to send an email and the response doesn't come a year later. I recently got a response to somebody I'd reached out to. It was literally a little over a year, and they said they were working down a backlog.
Wow.
Yes. So, you know, I think that Find Help is good for people who are very knowledgeable about using community resources or who already have relationships with people. But I think something higher level would be more helpful to community members trying to find things.
Okay. That's great feedback. Thank you. It's always good to hear all the different perspectives, because there's the consumer perspective for those who are using it themselves, and there's the provider perspective. So that's fantastic feedback. I appreciate that. There's a couple of comments. Sharing simple, easy to use resource available in multiple formats. Yes, we want to, again, make sure equity is central. So multiple formats is important, multiple languages. QQ, is that quick question? Are there case management resources equitable among all payers? That I do not know. Does anybody have feedback on that?
Is it in reference to a sliding fee schedule, or in what context are you asking?
Dawn, are you comfortable coming off mute to share?
Yeah, so just in general, in the individual payers across the network of Maryland, majority used, is there equitable resources available among each payer? Because if there's not, it's not a sustainable process or program to expect outcomes to occur if they're not equitable.
Yeah.
I mean, don't mean to put a damper on more challenges over top of challenges, but it just comes to mind.
No, it's good.
Unfortunately, that's the reality that we live in. So this is why it's so important to have groups like this.
Correct. So it may be a different approach in how the networks work together and share resources. And I think that's exactly what people are saying, to come together more as a community as a whole to share resources and information in the bigger picture. And this is what the work group is doing. So it's great work.
Love that. Thank you. Excuse me. I'm going to read a couple other comments. And feel free to, hop in, unmute yourselves to comment. Let's see, diverse providers from Dr. Cooper, avoids that cookie cutter approach, more tailored to meet the needs of the individual. Absolutely. Jennifer, we do use Find Help, but there are many resources that do not appear there. That's so true. Again, there's that provider piece. So it's almost as if, so the organizations themselves have to create their own, have to make themselves available in the Find Help system. So there's some nuances to that based on my understanding of that. So that is another barrier to consider if that's something we wanted to use. Melody, so I'm totally assuming a results-based accountability framework and not sure if this is helpful, but it could be something like families experience a coordinated, easy to navigate maternal health system that supports timely prenatal and postpartum care, regardless of insurance status or income. An indicator could be percent of births where prenatal care began in the first trimester. Is this helpful? It's incredibly helpful. Yes. Thank you. Any comment to that? Any feedback? Or Melanie, if you want to kind of speak a little more to that, you're welcome to.
Yeah, again, RBA is such an awesome framework to use. So I think that's what you're getting at to try to get us to some statements. But yeah, I think if we start broad, we would just need to try to work through indicators. And unfortunately, I have to run to another meeting. But this has been extremely helpful, and I look forward to the continued discussion.
Thank you so much for participating and for your feedback. We really appreciate it. More to come.
Great.
Annie,
Thank you all.
absolutely. Annie, I see your comment. Are folks aware of mdmom.org? That sounds so familiar. Do you want to share a bit more about that?
Sure. I'm not totally certain why the link did not appear in the chat, but it's a website that is essentially like Find Help, but it's specific for maternal health resources. Let me see if I can get an actual live link in here for folks to look at. I imagine it's not perfect, but it might be a starting point.
Oh, I see the link now. Awesome. Is anyone else familiar with this resource by chance?
I provide that to all of the pregnant members that I work with. I think all of our CMs do in our email that we send to them.
That's awesome. Okay. And do they find it helpful? What is some general feedback?
Honestly, I haven't gotten a lot of feedback on it,
Oh,
really, but I can maybe start asking questions and see.
Yeah, absolutely. And honestly, if that is an approach that if that's an action step that we want to take for a part of our plan, a part of that, this 3-year cycle could be, getting feedback on this resource. So if you don't have it now, that's totally fine. That's something we can work towards getting later if this is the approach we want to take moving forward. So this is great. And then Dr. Apgar, I see your comment. 1, increase access, low-cost translation services available for providers and pregnant patients by 100% by the 1st of the 2027. I love that. And then 2 is improve available evidence-based, language-specific, culturally competent information via social media by January 1st, 2027 too. So great ideas. Thank you, Dr. Apgar. You could absolutely, I could see us doing like a social media campaign of sorts. So, one of the things that I kind of talk about a lot is, consistent messaging. I think there's so many resources out there, and just making sure that we're all using the same language, the same messaging across the county. That way, regardless of where people are going for care or who they're seeing for services, the message is the same. So if you're in your first trimester, these are the things you need to focus on. If you're nearing the end of your pregnancy, these are the things that are important for this time. If it's postpartum, considering what resources are available there. So I love these ideas. Thank you, Dr. Apgar. And thank you, Annie, again for the link. I'll make sure I share that out in the follow-up email as well for anyone else who needs that. But okay, great. This is fantastic. Again, thank you all for leaning into this process with us. So what we'll do is we're going to take your feedback And then we're going to start putting these into the SMART goal objective format, kind of using some of these themes, these goals, to develop those objectives that go along with it. And then we'll present those to you all and prioritize, where we want to start, what we think, we can really put forth our greatest effort, our greatest resources, and start developing strategies from there. So that's how we're going to move from goals to strategies. Again, we just want to operationalize what we've started. So your continued partnership is definitely going to be key as we move from these ideas to action. And I am looking forward to continuing this work together with you all. And I know we have just 8 minutes left. So are there any last minute comments? And if not, we'll go into our community announcements. We just have a few. Any other last minute comments before we move forward?
I just felt that this process has been very productive, and it allows us to see things through the lens of different aspects and providers. So I think this is important, these conversations, and it allows us to remain connected and be able to problem solve. So I applaud this process. So thank you.
Thank you so much, Dr. Cooper.
And thank everybody.
Yes, thank you. Thank you so much. Any other comments, questions? And if anything comes to mind after this meeting, please, please, please feel free to email me. You can email the PGHAC email account as well, and I can put those in the chat for you all, for anybody who may need that again. But yes, thank you so much. I cannot do this without you all and without your feedback. All right, well, hearing none, let's go ahead and move into our community. Oh, co-chair recruitment. Yes. Thank you. Dr. Cooper, thank you. Yes, we are looking for another co-chair. So if you are interested in helping us lead this work group, it would be most valuable. Thank you. Thank you for considering. Please email me to let me know you're interested. Dr. Cooper has been a co-chair of a previous work group and now helping me with this one. It is not a lot of extra work. We meet one extra time very briefly during the month to just plan for the upcoming meetings and provide updates as needed. So it really isn't a massive commitment. Dr. Cooper, I don't know if you just want to speak to it just for a brief moment. No pressure.
No pressure, huh? It's just a tremendous opportunity to work with Shanae, AJ in the health department, and just the people that serve on these particular work groups, because they bring in, as I said earlier, we have spirited conversations, bold ideas, and we're all about being results oriented, and we want to make some sort of impactful difference in the community. So I invite anyone who would be interested in being a part of this particular journey and making some sort of difference in the community and feeling good about doing so as well. So I appreciate your consideration, and I appreciate you all for being here.
Thank you. I'm Sharon to see your hand raised. Bridgewayne.
Yes, I just had a question about the chip itself and how it's utilized. Like, if we come up with all these recommendations, how does it move to action? Is it the responsibility of the health department or some collaborative of community folks? How ultimately, how does this become an active document?
Great question. So it actually will become the responsibility of the coalition and its partners. The health department is a part of that, but that will be why it's really important when we go into our actual strategy development. Part of that is identifying, which partner takes the lead on this aspect of the plan, or, which partners are going to work together or work collaboratively, excuse me, I haven't had lunch yet, for another portion of the plan, so it really is going to be dependent on the strategies that we develop and what that looks like. But essentially, it will be the responsibility of the coalition and leaning to our partners, looking to our community members, hospital partners alike. There might be cross-county partners that may be familiar may have experience with certain strategies that we look to them for guidance. So it really is what we want this to be. And that's the beauty of the document, is that it is so flexible, and we can do really what we think is best with it. The other part that's exceptional about this document is that it's a living document. So say we're taking one approach and we really aren't finding ourselves successful in this, or we're coming across barriers that are preventing us from achieving a certain strategy, then we can make adjustments as we go along. Say there's new data that comes out and we need to, shift our priorities a bit to something else, then we can do that too. So it really is a flexible document, a flexible plan.
Thank you.
All right, well, with 3 minutes, I want to honor everyone's time, be respectful of everyone's time, because I know we're getting close to lunch. I'm stumbling over my words, so I know I'm getting hungry. But AJ, do you want to go ahead and share our community announcements for today?
Yeah, I'll run through them real quick. Our first opportunity to highlight is going to be the Dine, Learn, and Move, for Prince George's County partners are hosting monthly virtual sessions focused on staying active and making healthy choices. This month's topic is Plant-Based Made Easy, taking place Wednesday, March 28th from 6 to 7:30 p.m. Registration information is on the slide. We also wanted to lift up another event from Prince George's Mental Health Champions. They're hosting Come Out and Play, a free ice skating event for all ages at the Bowie Ice Arena. This will take place Friday, May 1st from 6 to 8 p.m. You can find more information by using the email or the QR code listed on the slide. We also wanted to re-highlight the GOAT, or GOAT Youth Mental Health Expo, taking place Saturday, May 2nd at Bowie State University. This is a free event for youths ages 16 to 25 and their families, featuring workshops, resources, live performances, and connections to support services. And then last but not least, one more event is going to be Spring into Wellness, hosted by Prince George's County's Mental Health Champions. This Behavioral Health Expo will take place Saturday, May 16th at the Southern Regional Technology and Recreation Complex. This is a free interactive event for all ages, featuring a farmer's market, food demonstrations, fitness activities, health screenings, and educational resources. I think, yeah, that's all the announcements from my end, but I will put in the chat our coalition directory update link.
Great. So I know we ran through those pretty quickly, but for those who are new, I will send an email as a follow-up to this meeting. So you'll have access to the recording, you'll have access to the slides, as well as our community announcements. If there are additional community announcements, please feel free to email me the flyers, to send me the information. I'm happy to include those in the follow-up as well. If you have not already, please take a moment to complete the coalition directory update so we know who our partners are and who we're working with, and we can keep that information up to date. And our next meeting will be next month, Thursday, April 16th, same time, same place. And we look forward to seeing you all then, working closely with you all. Thank you all so much for your insight and your partnership. We appreciate you all being here today. Enjoy lunch and have a great afternoon. Thank you all.